Stop. Before you ignore that weird color, burning sensation, or those strange bumps on your tongue, listen up. What if we told you that the color, texture, and even the way your tongue feels could be screaming serious warnings about your health? Think about it. Doctors can sometimes diagnose illnesses just by looking at your tongue. A bright red tongue might mean a dangerous vitamin deficiency. White patches could point to infections or even precancerous conditions, and a burning sensation. That could be linked to nerve issues or even diabetes. And that's just scratching the surface. In this video, we're diving into 10 shocking health issues your tongue might be trying to warn you about. Some of these might sound unbelievable. So before you dismiss that weird tongue symptom as nothing, stick around, because what you learn today could actually save your life. Ready? Let's get started. Number 1. Pale tongue. A pale tongue can be a telltale sign of iron deficiency anemia, a condition where the body lacks sufficient healthy red blood cells due to inadequate iron. Iron is essential for producing hemoglobin, the protein in red blood cells responsible for oxygen transport. When iron levels drop, hemoglobin production decreases, leading to fewer and paler red blood cells. This reduction manifests as a pale appearance of the tongue and other mucous membranes. A study published in the Journal of the Formosan Medical Association in 2014 delved into this connection. Researchers compared individuals with iron deficiency anemia to a control group of healthy adults. Focusing on oral manifestations, they found that 27% of the anemic participants exhibited a pale tongue, while this feature was absent in the control group. This study underscores the importance of oral examinations in detecting underlying systemic conditions like anemia. So, the next time you notice your tongue looking a bit paler than usual, it might be worth checking in with a healthcare professional. Your tongue could be giving you a sneak peek into your body's iron status. Number 2. Bright red tongue. A bright red tongue can be a telltale sign of vitamin B12 deficiency, a condition that significantly impacts overall health. Vitamin B12 is essential for DNA synthesis and the production of red blood cells. When the body lacks sufficient B12, it hampers DNA synthesis, leading to the improper formation of epithelial cells, including those on the tongue. This disruption manifests as a condition known as atrophic glossitis, where the tongue appears smooth, shiny, and beefy red due to the loss of papillae. The tongue's rapid cell turnover makes it particularly susceptible to changes in nutrient levels, causing these noticeable alterations. Supporting this connection, a study published in 2018 in the Therapeutics and Clinical Risk Management Journal evaluated the diagnostic value of oral beefy red patches as a marker for B12 deficiency. Researchers examined 136 patients who reported oral discomfort, burning sensations, or recurrent ulcers. Among the 70 patients diagnosed with B12 deficiency, 87.1% exhibited these distinctive tongue patches. In contrast, only 40% had an abnormal mean corpuscular volume, a common blood test indicator for B12 deficiency. This suggests that observing a bright red tongue could be a more reliable early indicator of B12 deficiency than traditional blood tests. So, the next time you notice your tongue looking unusually red and smooth, it might be worth considering a check on your B12 levels. Number 3. Purple or bluish tongue. A purple or bluish hue on your tongue isn't just a quirky discoloration. It's your body's way of waving a flag that something might be amiss, especially concerning your circulatory system. When your blood isn't delivering adequate oxygen to tissues, a condition known as cyanosis, areas like your tongue can take on this bluish-purple shade. This happens because oxygen-depleted blood is darker, and when it circulates close to the skin or mucous membranes, it imparts that telltale color. But what's the science behind this? Our red blood cells are like little oxygen taxis, ferrying O2 from our lungs to tissues all over the body. When they're fully loaded with oxygen, they appear bright red. However, if there's a hitch in the delivery, be it from lung issues, heart problems, or blocked airways, the blood returns darker and gives areas like the tongue a bluish tint. Think of it as a visual cue that your body's oxygen supply chain has hit a snag. Backing this up, a study published in the AIP conference proceedings in 2023 delved into the connection between tongue color and various health conditions. Researchers from Iraq and Australia analyzed over 9,000 tongue images, focusing on color variations. They discovered that a purple tongue often correlated with circulatory issues, such as heart disease. By employing image processing techniques, they achieved a 94% accuracy rate in diagnosing diseases like diabetes, renal failure, and anemia based solely on tongue color. This study underscores the tongue's potential as a diagnostic tool, reflecting internal health hiccups. So, if you ever notice your tongue sporting a purple or bluish shade, it's not just a cosmetic concern. It could be your body's way of hinting at underlying issues like heart disease, respiratory problems, or other circulatory disturbances. Paying attention to these signs and seeking medical advice can help nip potential problems in the bud. Number 4. White patches or coating. White patches or coatings on the tongue can be more than just an unsightly nuisance. They often serve as indicators of underlying health issues. One common cause is oral thrush, a fungal infection resulting from an overgrowth of Candida yeast. This condition manifests as creamy white lesions on the tongue and inner cheeks, sometimes extending to the roof of the mouth, gums, and tonsils. The overgrowth occurs when the delicate balance of microorganisms in the mouth is disrupted, often due to factors like antibiotic use, diabetes, or a weakened immune system. The Candida fungus, normally present in small amounts, proliferates, leading to the characteristic white patches. These patches can be wiped off, often revealing red, inflamed tissue underneath. A study published in the Journal of Dental Research in 2023 examined 500 patients with oral thrush and found that 65% reported recent antibiotic use, while 40% had underlying immunosuppressive conditions. Another culprit behind white patches is leukoplakia, a condition marked by thickened, white or grayish patches that can develop on the tongue, gums, or the inside of the cheeks. Unlike oral thrush, these patches cannot be scraped off. Leukoplakia is often associated with chronic irritation from tobacco use, whether smoking or chewing, and excessive alcohol consumption. The exact mechanism involves the proliferation of epithelial cells in response to these irritants, leading to the formation of these patches. While leukoplakia itself is benign, there's a small risk it can progress to oral cancer. Research highlighted by the National Health Service indicates that a small percentage of leukoplakia cases, especially those with certain cellular changes, may develop into squamous cell carcinoma. Regular monitoring and, in some cases, biopsy are recommended to assess the potential for malignancy. In summary, white patches on the tongue can be harbingers of various health issues, ranging from infections like oral thrush to potentially precancerous conditions like leukoplakia. Number 5. Black, hairy tongue. Black, hairy tongue is a benign, yet visually striking condition characterized by the elongation and discoloration of the filiform papillae on the tongue's surface. Under normal circumstances, these tiny, hair-like projections undergo regular shedding, maintaining a consistent length and appearance. However, in black, hairy tongue, this natural exfoliation process is disrupted, leading to the overgrowth of these papillae, which can extend up to 18 millimeters in length. This elongation creates a fertile environment for the accumulation of debris, bacteria, and yeast, resulting in the distinctive black or brownish hue associated with the condition. Several factors contribute to the development of black, hairy tongue, with poor oral hygiene being a primary culprit. Inadequate brushing and flossing allow for the buildup of food particles and microorganisms on the tongue's surface, promoting papillary overgrowth and discoloration. Additionally, lifestyle habits such as smoking and excessive alcohol consumption have been implicated in the onset of black, hairy tongue. The tar and nicotine in tobacco products can stain the tongue, while alcohol can alter the mouth's natural flora, both contributing to the condition's manifestation. A diet predominantly composed of soft foods may also play a role, as the lack of abrasive textures fails to aid in the natural shedding of the papilla. Medications, particularly antibiotics, have been linked to black hairy tongue as well. A case reported in the BMJ case reports in July 2023 detail an instance where a patient developed black hairy tongue following antibiotic therapy. The study highlighted that certain antibiotics could disrupt the oral microbiome, leading to an overgrowth of pigment-producing bacteria and subsequent black discoloration of the tongue. In this particular case, the patient's tongue returned to its normal appearance 3 months after completing the antibiotic regimen, underscoring the condition's reversible nature when the underlying cause is addressed. While black hairy tongue is generally harmless and often asymptomatic, its presence can sometimes signal underlying health issues or risk factors. For instance, individuals with compromised immune systems or those undergoing radiation therapy may be more susceptible to developing black hairy tongue. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Number 6. Smooth, glossy tongue. A smooth, glossy tongue, medically termed atrophic glossitis, can be a visual cue pointing towards significant health issues, particularly deficiencies in essential nutrients like iron and vitamin B12. This condition arises when the tongue's papilla, the tiny, hair-like projections responsible for its textured appearance, undergo atrophy or shrinkage. But how exactly does this transformation occur, and what does it signify about one's health? Iron and vitamin B12 are pivotal for the maintenance and function of various bodily tissues, including those in the oral cavity. Iron is a cornerstone in hemoglobin production, the protein in red blood cells that ferries oxygen throughout the body. A deficiency in iron means tissues, including the tongue, receive less oxygen, leading to their degeneration. Vitamin B12, on the other hand, is crucial for DNA synthesis and the formation of red blood cells. Insufficient B12 disrupts these processes, resulting in megaloblastic anemia, a condition characterized by the production of abnormally large and dysfunctional red blood cells. This anemia further compromises oxygen delivery to tissues, exacerbating the atrophy of the tongue's papilla. When the body lacks sufficient iron or vitamin B12, several pathological changes ensue. For instance, diminished hemoglobin levels lead to decreased oxygen transport. The tongue's mucosal cells, deprived of adequate oxygen, begin to atrophy, causing the loss of papillae and resulting in a smooth, glossy appearance. Furthermore, vitamin B12 deficiency hampers DNA production, affecting rapidly dividing cells like those on the tongue's surface. This impairment leads to mucosal thinning and papillary atrophy. Both deficiencies can trigger inflammation of the tongue, known as glossitis. The inflammatory process contributes to swelling, redness, and pain, further altering the tongue's appearance and function. Healthcare providers should consider comprehensive evaluations, including detailed dietary histories and appropriate laboratory tests, to identify and address these deficiencies. Timely treatment, often involving dietary modifications and supplementation, can reverse the tongue's changes and alleviate associated symptoms. Number 7. Swollen tongue. A swollen tongue, medically termed glossitis, isn't just a pesky inconvenience. It can be a flashing neon sign indicating deeper health issues. When your tongue swells, it's often due to inflammation, which can stem from various sources like infections, allergies, or even systemic conditions. This inflammation increases blood flow to the tongue's tissues, causing it to puff up. But why should we care about a little tongue swelling? Well, because it's sometimes the first clue to more significant health concerns. For instance, certain medications can have side effects that lead to tongue swelling. A case reported in the BMJ Case Reports Journal highlighted a patient who developed unilateral tongue swelling as a rare presentation of angiotensin-converting enzyme inhibitor-related angioedema. This case underscores the importance of recognizing medication side effects as potential causes of tongue swelling. Infections are another culprit. Bacterial or viral invaders can set up camp in the mouth, leading to inflammation and swelling. In some cases, a swollen tongue might be a sign of oral thrush, a fungal infection that requires prompt treatment. Autoimmune disorders, where the body's defense system mistakenly attacks its own tissues, can also manifest as tongue swelling. Conditions like Sjogren's syndrome or lupus often have oral symptoms, with glossitis being a common feature. In these scenarios, the immune system's overactivity leads to chronic inflammation, causing the tongue to enlarge. So, the next time your tongue feels puffier than usual, consider it a friendly nudge to check in on your overall health. Number 8. Tongue with deep grooves. A tongue adorned with deep grooves, known as a fissured tongue, might seem like a quirky anatomical feature, but it can serve as a window into one's overall health. These grooves, ranging from 2 to 6 millimeters in depth, predominantly grace the anterior 2/3 of the tongue's dorsal surface. While often benign and asymptomatic, their presence can sometimes signal underlying health issues. The exact cause of a fissured tongue remains a bit of a mystery, but genetics play a significant role. Studies have shown a higher prevalence of fissured tongues among individuals with certain genetic conditions, such as Down syndrome and Nelkerson-Rosenfeld syndrome. In these cases, the grooves may be more pronounced and accompanied by other symptoms. Beyond genetics, a fissured tongue has been associated with systemic conditions like diabetes mellitus. Research published in the Hellenic Archives of Oral and Maxillofacial Surgery in 2021 highlighted this connection. The study suggested that factors such as inadequate blood glucose control, immunological changes, and altered salivary flow in diabetic patients might contribute to the development of fissured tongue. While the exact prevalence wasn't specified, the association underscores the importance of monitoring oral health in diabetic individuals. Age is another contributing factor. A cross-sectional study published in the International Journal of Applied Dental Sciences in 2018 found that the prevalence of fissured tongue increases with age. The study, which examined 100 subjects, reported that fissured tongues were least common in the 0 to 20-year age group and most prevalent in the 21 to 40 age group, followed by 41 to 60 years and 61 to 80 years. This trend suggests that as we age, our tongues might develop more character, quite literally. The study also delved into the patterns of these grooves. The most common presentation was a central longitudinal fissure, observed in 50% of cases. This was followed by transverse fissures branching from a central groove and other less common patterns. Interestingly, while the grooves might look dramatic, they often don't cause discomfort. However, food particles can lodge in these crevices, potentially leading to irritation or bad breath if not cleaned properly. While a fissured tongue is usually harmless, it's essential to pay attention to accompanying symptoms. For instance, if the grooves are paired with a burning sensation, changes in color, or swelling, it could indicate other conditions like oral infections or nutritional deficiencies. Regular dental checkups can help monitor these changes and ensure that your tongue remains in tip-top shape. Number 9. Ulcers or sores. Tongue ulcers, those pesky little sores that make eating your favorite spicy foods a challenge, can be more than just a minor annoyance. They might be your body's way of waving a red flag, signaling underlying health issues that deserve attention. But how exactly do these ulcers form? And what secrets might they reveal about our overall health? At their core, tongue ulcers, or oral ulcers, are open sores that develop when the delicate mucous membrane lining the mouth breaks down. This breakdown exposes the sensitive underlying tissues, leading to that all-too-familiar pain, especially when savoring your morning coffee or indulging in a citrusy treat. But what causes this mucosal breakdown in the first place? Several factors can trigger the formation of tongue ulcers. Accidentally biting your tongue, irritation from sharp-edged foods, or ill-fitting dental appliances can damage the mucous membrane. A lack of essential nutrients, particularly B vitamins like B9 and B12, can make the mucosa more susceptible to ulceration. These vitamins play a crucial role in cell regeneration and repair, and their deficiency can hinder the mouth's ability to heal minor injuries, leading to ulcer formation. Viral infections, such as those caused by the herpes simplex virus, can lead to ulcerative lesions in the oral cavity. These infections cause inflammation and cell death in the mucosal tissues, resulting in painful sores. Conditions like Crohn's disease, a type of inflammatory bowel disease, can manifest in the mouth. In fact, up to 35% of individuals with inflammatory bowel disease experience oral manifestations, including ulcers. The inflammation characteristic of inflammatory bowel disease doesn't confine itself to the gut. It can affect any part of the gastrointestinal tract, including the mouth, leading to ulcer formation. While a solitary ulcer that heals within a week or two is usually harmless, recurrent or persistent ulcers can be indicative of more significant health concerns. For instance, Crohn's disease often presents with oral lesions before other gastrointestinal symptoms become apparent. These oral manifestations can include diffuse mucosal swelling, deep linear ulceration, and fibrous tissue tags. Recognizing these signs can lead to earlier diagnosis and management of the underlying condition. Another condition to consider is Behçet's disease, a rare disorder causing blood vessel inflammation throughout the body. One of its hallmark symptoms is recurrent oral ulcers, which are often painful and can resemble common canker sores. However, unlike typical canker sores, these ulcers are more frequent and may be accompanied by genital ulcers and eye inflammation. Early recognition of these patterns is crucial, as timely intervention can prevent more severe complications associated with the disease. While not every tongue ulcer is a cause for alarm, it's essential to pay attention to your body's signals. Persistent or recurrent ulcers, especially when accompanied by other symptoms like gastrointestinal discomfort or unexplained fatigue, warrant a conversation with a healthcare professional. Number 10. Burning sensation. Experiencing a burning sensation on your tongue isn't just a quirky annoyance. It can be a red flag for underlying health issues. This discomfort, often termed burning mouth syndrome, manifests as a persistent burning feeling on the tongue, lips, or other areas of the mouth, without any visible abnormalities. Delving into the science behind this sensation reveals a complex interplay of neurological and systemic factors. At the heart of burning mouth syndrome lies the intricate network of nerves responsible for taste and pain. Research suggests that primary burning mouth syndrome may stem from dysfunction or damage to these nerves, leading to misfired pain signals being sent to the brain, even in the absence of an actual injury or burn. This neuropathic pain is akin to a malfunctioning alarm system, blaring without a fire. Beyond neurological factors, several systemic health issues can manifest as a burning tongue sensation. Hormonal fluctuations, especially during menopause, have been linked to burning mouth syndrome, with a higher prevalence observed in women around this stage. Nutritional deficiencies, particularly in B vitamins, iron, and zinc, can also lead to this discomfort, as these nutrients are vital for nerve health and function. Moreover, conditions like dry mouth, often a side effect of medications or autoimmune disorders, reduce saliva production, leading to a parched, burning feeling in the mouth. A noteworthy study published in BMC Oral Health in January 2023 delved into the efficacy of low-level laser therapy for burning mouth syndrome patients. This systematic review analyzed multiple clinical trials to assess how low-level laser therapy impacts burning pain and quality of life. The researchers scoured databases like PubMed, Embase, and the Cochrane Library, selecting studies that met stringent inclusion criteria. Their analysis revealed that a significant percentage of patients undergoing low-level laser therapy reported a reduction in burning sensations, with some studies indicating improvement rates as high as 70%. Additionally, Many participants experienced enhanced quality of life post-treatment, highlighting low-level laser therapy as a promising non-pharmacological intervention for burning mouth syndrome. So, these were the top 10 serious health issues your tongue can reveal. Now, we want to hear from you. Which of these surprised you the most? Do you recognize any of them in yourself or someone you know? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.